Hi, this is Jeevatnam and welcome to my channel Jeevan Astro Answers. And this topic is about diarrhea. Diarrhea is a disease of the intestines. It's a common problem eating foods that it may upset the digestive system and which it may lead to loose, watery stools and possibly more frequent bowel movements. If you have diarrhea, you will typically experience loose, watery stools and feel the urgent need to have a bowel movement multiple times a day. Diarrhea can be acute or chronic. Acute diarrhea lasts for a few days up to a week. Chronic diarrhea usually lasts for more than 3 weeks. During the normal digestion, food is always kept as liquid. This is due to the secretion of large amount of water in the stomach, upper small intestine, pancreas and gallbladder. The undigested food reaches the lower small intestine and colon in liquid form. Here, in the small intestine and the colon, the excess water get absorbed, and the undigested food turn it into a solid stool form. In diarrhea, the stools become watery. This is because the stomach and small intestine secrete too much fluid, or the distal small intestine and colon do not absorb enough water, or maybe the undigested liquid food passes too quickly through the small intestine and colon without the removal of excess water. Sometimes inflammation of the intestinal lining may also play a role in diarrhea. Because of the extensive scarring, the colon couldn't absorb fluids and electrolytes, which that it may lead to diarrhea. Sometimes viruses, bacteria, and even parasites may inflame the lining of the small intestine and cause increased secretion of fluid. These microbes produce toxins, that is, chemicals, that also inflame the small intestine and colon, which that it leads to diarrhea. Malabsorption is an inability to digest or absorb sugars. The most recognized malabsorption of carbohydrate, that is sugar, is lactase deficiency, which is also known as lactose or milk intolerance. Milk products containing the milk sugar lactose can lead to diarrhea. In the intestine, lactose is broken up into its component sugars, galactose and glucose, and then it gets absorbed into the body. This reaction has been promoted by the intestinal enzyme called lactase. But if the enzyme lactase is absent, then lactose cannot be digested. As a result, the lactose cannot be broken up into the intestine. Without being broken up, lactose is failed to be absorbed by the body. The undigested lactose pulls water by osmosis when it reaches the colon. Further, The lactose can be processed into chemicals and gas such as hydrogen and methane by colonic bacteria, which may promote the retention or secretion of fluid in the colon. The result of these events leads to diarrhea. Although lactose is the most common form of sugar malabsorption, other sugars in the diet like fructose and sorbitol may also cause diarrhea. Malabsorption of fat is the inability to digest or absorb fat. This may also cause diarrhea. Pancreatic secretions that are very necessary for the normal digestion of fat. If the pancreatic secretions get reduced due to pancreatitis or pancreatic cancer, then the fat malabsorption may occur. Sometimes diseases in the lining of the small intestine that it may prevent the absorption of digested fat. For example, celiac disease. Moreover, bacteria in the small intestine and colon turn the undigested fat into substances, that is, chemicals that cause water to be secreted by the small intestine and colon. Passage through the small intestine and colon also may be more rapid when there is a malabsorption of fat. And several endocrine diseases, that is, imbalances of hormone, may also cause diarrhea. For an example, overactive thyroid gland, that is, hyperthyroidism, and an underactive pituitary or adrenal gland, that is, addition disease, may also cause diarrhea. Some inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, which may cause the inflammation of the small intestine and colon and commonly cause chronic diarrhea. Colon cancer can cause either diarrhea or constipation, and patients with AIDS often have chronic infections of their intestines may also lead to diarrhea. Moreover, an adverse reaction to a medication can lead to diarrhea. Many medications, such as antibiotics, can cause diarrhea. Antibiotics relieve infections by killing bad bacteria, but they also kill good bacteria also. This disturbs the natural balance of bacteria in the intestines and thus it leads to diarrhea. Surgeries like gallbladder, stomach surgery may also cause diarrhea. Diarrhea creates a complications such as dehydration, electrolyte imbalances, and irritation of the anus. If you have signs of serious dehydration, follow the medical assistance properly. And indications of dehydration include excessive thirst, dry mouth or skin, little or no urination, weakness, dizziness or lightheadedness, fatigue, dark colored urine, nausea, vomiting, abdominal cramps, etc. According to astrology, Virgin sign and the sixth house is the seat for stomach and bowel diseases. Sun significates bowel. Leo sign and fifth house can also be linked with diseases connecting abdomen. Ketu causes pains, Mars, Mercury causes ulcers, Rahu gives illness. Venus planet is responsible for gastritis, nausea, indigestion, etc. In stomach ache, Sun, Saturn, Ketu, Sign, Virgo, and sixth houses are seen. So, any affliction to the above said planets, signs, and houses that it leads to stomach diseases. Luckily, diarrhea is usually short lived, lasting no more than a few days. But when the diarrhea lasts beyond a few days into weeks, it usually indicates that there is another serious problem such as irritable bowel syndrome or a more serious disorder including persistent infection, celiac disease or inflammatory bowel diseases. And diarrhea can be life-threatening if left untreated. Most diarrhea deaths are the result of contaminated water supplies, food poisoning, and insufficient sanitation. That too, dehydration is particularly dangerous in children, older adults, and those with weakened immune systems. And antibiotics should not be used to treat diarrhea unless there is a culture proven microbial infection that requires antibiotics. So, if you have diarrheal symptoms associated with nausea, vomiting, abdominal pain, or weight loss, then please seek medical attention immediately. I hope you might have received some useful information from this video. We will meet you soon in my next video. Till then, take care and bye.